Hi there, my name's Stacey Anderson and I'm a GP in Ayrshire and a clinical lead for realistic medicine. I want to tell you a bit about the importance of something called anticipatory care planning, or ACP. ACP is where you talk about what matters most to you when making plans for your care in the future. Making plans in advance means there's less to think about if you become unwell. If you're a carer, you can make plans for supporting the person you care for if your own health changes. Everyone is different and has their own plan. Things to consider in an ACP can include personal information about what matters to you and your family, where you or your loved one would like to be cared for example, home, hospital, hospice, or other homely setting. How you would like to be supported or cared for by family, by carers. Medical treatment plans, for example, if there are certain treatments that you would not wish to have. Decisions about resuscitation in the event of a cardiac arrest. You can talk about this with those close to you and your doctor, nurse, or care worker. Your care team want to know what's important when they're planning treatment and care with you. Once you've made decisions regarding your ACP, it is important to communicate these to those caring for you and to your GP, so it can be shared with anyone who may be looking after your health, so that your wishes can be followed. This information is shared on something called a key information summary and allows members of the general practice team, the out-of-hours service, paramedics and the hospital team to have access to your ACP and to therefore know what your priorities are. Talking about your health and what matters to you can help you do various things. To manage changes in your health and well-being or family situation, to have a plan for what to do if you or your carer gets ill or need help in an emergency, to tell people what you would like to be able to do, and to record anything that you do not want to happen to you. If you're unwell, your family or friends may need to help make decisions about your treatment and care. Having a care plan makes this easier for them. Whilst anyone can have an ACP, it is particularly important and helpful if you have a long-term health condition, have disabilities, or have many health and support needs, if you are an older person and you need regular help and support, if you are a young person or the parent or carer of a child or young person with a life-limiting health condition. People often start to think ahead and talk with friends and family when life events happen, such as a new diagnosis, a hospital admission, moving into a care home, or a decline in health. Over time, your health and situation may change. Your anticipatory care plan can be updated at any time. You can ask for this to happen. Your GP, nurse, or another professional may suggest reviewing your plan. If you would like to know more about making an ACP, then a lot of useful information can be found on the NHS Inform website.